I'm Vicki Liviakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. And with us today, we have plastic surgeon Dr. Joseph Mealy. And we're going to be talking about cosmetic breast enhancements. Later, we'll be taking your calls, answering any questions you might have for the doctor. Here's the phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, you'll certainly want to consult your own physician as well. Welcome back to the program, Dr. Mealy.
Thank you. Nice to be here.
We always love to have you on.
Thank you.
We're talking about cosmetic breast enhancements. What does that encompass exactly?
Just about anything you could imagine.
Anything that goes on with the breast?
Larger, smaller, changing the shape, lifting them, or even some of the finer details in terms of nipples, areolas. Just about anything you can imagine, we can do something with.
Well, you've also got a brand new website, and it's
the sanfranciscobreast.com.
So it's all about the breast.
It's all about breasts, all the cosmetic things that we do to enhance the breast.
Okay, so when people ask you questions, what's the number one most common question?
The most common question I get has to do with breast enhancement, and it's more along the lines of how much volume do I need to get to a certain cup size? And there's no, complete answer. It's dependent on where we're starting from, what size the patient is, and what they think that cup size is, because there's a lot of variation depending on even the manufacturers of what a C cup is.
Now, I don't want to trivialize breast enhancements, but in a way it's like fashion. I mean, are there trends that come and go? Are people going a little bit, there was a time they were going really pretty large, and
I think there are some
tapering
trends.
back?
There are some geographical preferences too. I mean, different areas of the country tend to have different implant sizes, but around here it seems to be pretty much in that C cup range, full C, small D, still very popular.
Okay. I asked you what the most common question is on your website. What would be probably one of the more unusual questions people ask?
Well, I had a posting on my blog about nipple piercings and breast augmentation.
Ooh.
And I like to track and see what people are looking at. A lot of people are very interested in that.
A lot of people?
Not that I do the piercing
Bay Area
part,
wide.
but
okay.
Yeah, Bay Area wide.
And you had an answer for them?
Sure. No, the question was whether, it was safe to do them. And I think it is, but just not concurrently.
Yeah, probably not.
Yeah.
Risk of infection, that sort of thing. Okay, let's talk about breast augmentation now. Are there different types of augmentation?
There's different implants available, different fillers for the implants, different positions to put the implants, and even different incisions that we use to place them.
Okay, so the materials, we sometimes have demonstration models. We don't have them here today, but you've got saline is available.
Sure. Saline and silicone-filled implants. They both have a silicone shell, so the part that touches the body is pretty much the same, but the fillers are a little bit different, and there's advantages and different disadvantages to each.
Many years ago, saline was the only thing that was available because there was a backlash against the silicone.
Sure.
Silicone is back. Is there a preference of people kind of leaning more towards one or the other, and what are the advantages and disadvantages?
What's interesting is before all the controversy, it was about 50-50, maybe a little bit more use of the silicone versus saline, and we're kind of back to that again. So I think the preferences, the most common reason I think people use the silicone gel-filled implants is the way that they feel. They tend to be soft, more like normal breast tissue. So it's harder to detect that there's an implant in there when touching the breast. In clothing, doesn't really matter. They both look the same and act the same. The main reason I have patients choosing saline is that they're concerned if the silicone leaks, they don't want to deal with the aftermath. And it is a bigger deal if the silicone leaks. Saline implants, if they leak, the water just goes into the body, it gets absorbed just like we drank it, and it's gone, so there's no residual from it. But with the silicone, the body will try to wall it off and make scar, and that can be a problem.
Okay, pardon this analogy, but I'm thinking of a flat tire, so if the saline leaks out, can you inject it with more saline, or do you have to actually take the implant out and replace it?
The problem is usually there's a hole in the implant, so we have to put a new implant in.
Okay.
But, like a tire, there is a warranty. So the implant is always replaced. The main companies here in the U.S. are Allergan and Mentor. Both offer lifetime replacement warranties, and also they will give you money towards the surgery if it happens within the first 10 years.
Okay, so they are warranted.
They are warranted. I have details of that on my website if people want to read more about it.
Okay, we need to take a quick break, but for more information about Dr. Mealy, you can call him 925-943-6353 or check him out on the web at drmealy.com. He's also on sanfranciscobreast.com. When we come back on Body Beautiful, we'll take your phone calls and show you some before and after pictures. Stay with us.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.